Welcome to Southern Maryland Community Network's training on ethics, narrated by Karen Carloni, Executive Director. Ethics is about deciding what you should do and whether or not what you're doing is right. The functions of professional ethics are to protect clients from harm, setting forth the ethical obligation and role of the counselor or provider within the program setting. It creates standards, roles, responsibilities, and conduct for behavioral health staff. It identifies ethical considerations relevant to the supervisor and staff, and identifies the nature of the provider's responsibilities. It helps the provider design with the client a plan and expectation of the provider and program, and defines the limitations and the basis for processing complaints. We followed the Maryland Board of Professional Counselor Code of Ethics, which lays out ethics for professional competence and ethical responsibility in the COMAR regulations, COMAR 1058-0303 and 1058-0304. It also includes the ethics of the counseling relationship, ethics relating to fees and bartering, and describes ethical violations. Some categories of ethical violations are below: dual relationships with consumers, sexual misconduct, patient abandonment, use of drugs or alcohol with patients, committing an act of immoral or unprofessional conduct in the practice of clinical or non-clinical counseling or therapy, engaging in an act of unprofessional conduct in the practice of clinical or non-clinical counseling or therapy, breaching confidentiality, excessive or fraudulent billing, poor record keeping, willful misrepresentation providing services, practicing with an expired license or certificate, practicing without the proper credential or license, and using power to coerce or exploit clients. There are certain factors that contribute to providers acting outside of known ethical guidelines. Sometimes it's due to the patient and provider relationship. Sometimes it's due to vicarious re-traumatization of the provider, transference and countertransference relationships, life changes such as aging issues, deaths in the family, job stressors, medical issues, financial stressors, having codependency issues, or experiencing community pressure to do certain things in that counseling relationship. These are all considerations that may make someone breach their normal ethical boundaries. To be more ethically aware, we need to enhance our self-connection and awareness. We need to know our code of ethics. We need to consult with supervisors. We also need to do some self-examination of what part of us is making the decision and whether we're operating out of a wise mind. What will happen if you're not perfect or disappoint others? Recognizing whether you're in a therapeutic role or historical role, and whether you're operating out of your personal code or your licensing ethics. Self-awareness creates better ethical decisions. We also can make the unconscious conscious in order to reduce blind spots. We can restructure our persona as being a good enough therapist or provider, creating balance and self-care, healthy coping mechanisms, outlets for self-expression, and making sure we don't multitask. Sometimes it's wise to delay responses by waiting and observing the facts and making decisions after some consideration. Learning to decrease our emotional reactivity and using meditation and grounding techniques also will help us make better ethical decisions. Here at SMCN, we urge you to take care of your own mental health care, and if you have any concerns or are unsure about the ethics of a decision regarding treatment of any SMCN client, you can see our compliance officer, Rush Cox, or Human Resources, or your supervisor. You can also take advantage of our EAP program. Thank you for your time and attention today.